Let's go.
Fantastic to see you upright, Marijke. Welcome everyone back to Decipher Your Health. And
Hi,
I'm going
everyone.
to start off by asking Marijke how she's doing, because she's been sick with a nice old virus for the past 6 weeks since she was on her conference, her Health Writers Conference. Do
Yeah,
tell.
I thought it was a cold, but now I'm beginning to wonder if it was COVID because I read that the new variant is causing conjunctivitis in children. And for a couple of weeks, I had very itchy, watery eyes, and I don't have allergies. So, and colds do tend to trigger my asthma and make me quite sick, but never this sick. Like we're 6 weeks later and I'm still having trouble breathing. So, if any of you out there, if you have any respiratory issues whatsoever and you catch a cold or you get COVID, speak to your doctor as soon as you can, because you don't want it to get how it's gotten for me. And it wasn't like I didn't take care of it right away, because I know whenever I get a cold or a respiratory virus that my reactive asthma will do this. But it's
Now,
been sorry.
I'm sorry, did you test yourself for COVID?
I tested myself several times, but the kits that we have are from the original first few months. So either maybe they don't register
Their
the
shelf life.
the
Yeah.
virus, or they're either too old or they don't test for the particular variants that are going around now. But I strongly suspect now it was COVID than over a
Well,
cold.
and just frustrating given how militant you were about wearing a mask, because you know that you have a tendency to get respiratory viruses.
Yeah.
So, again, this is another example where if you see someone wearing a mask, don't berate them for wearing a mask. If the incidence of COVID is low in your area, they may have other underlying issues that they're trying to protect themselves from as well.
Exactly.
And it's not a personal affront on you that they're trying to hide part of their face.
Right.
Maybe they're just, or maybe they have a cold and they're trying not to get you sick while they run in to get their medications from the pharmacy.
Well, the funny thing is, before the pandemic hit, because I traveled a lot. I would travel 8 to 10 times a year, sometimes for conferences, sometimes for pleasure. And I had a mask with me in my carry-on luggage, because you never know who's sitting beside you. And if that person was really coughing, then I would put my mask on.
Yeah.
And, nobody thought twice about it. Oh, there's that lady sitting in 14F wearing a mask. It was just, she's wearing a mask. But now it's become such a, should I wear a mask? Shouldn't I? And, sometimes I take the bus a lot. Our public transit in Montreal is really good. And often I'll be the only one on the bus wearing a mask. And if you choose not to wear a mask, that's fine. But like you said, don't try and second guess why somebody's wearing one. My cough is really bad, so it scares the people around me.
Right. Right. So they're probably grateful you have a mask on.
There you go. But what's funny is when you have a mask and you cough, I still put my hand over my mouth.
Yeah. Force of habit, that's not necessarily a bad thing.
Yeah.
Yeah. Yeah.
So,
well, you had to go to the physicians a number of times to advocate for your care. And since we're all about advocating for our own health care and for our loved ones, do you want to go through the good, the bad, and the ugly of that process at all?
Sure. Well, I think especially if you have a chronic condition, like I do, you have to have a plan. And that is where I fell short. I have a plan in that I know I get a cold, it triggers my asthma, I call my doctor, I go on prednisone. But there really should be a better plan, something I could do before I call the doctor. And I think that's the important issue. I think that's what a lot of people need to do. And I'm actually meeting with a specialist on Tuesday, and hopefully this is starting to abate. But what I'm going to talk to him about once we've dealt with this is, what should I do the minute I know I have a cold?
Can I ask a few questions? So in the United States, we have something called asthma action plans, and they sometimes are dependent upon the age of the individual, pediatric population versus adult population. And they also, you had mentioned to me in the past that inhalers just do not seem to work for you.
Right.
And sometimes that is a part of the asthma action plan for some individuals. Do you have, or have you heard of the asthma action plan at all? Or
I have not. Hopefully on Tuesday I will.
okay, good.
Yeah, no, I haven't. I was thinking again because of the type of asthma I have, the puffers don't work. So I was thinking maybe, I mean, the specialist might correct me, but I was thinking maybe low dose prednisone as soon as I start. That would be
Yeah.
my first reaction. Because the problem is when I get put on prednisone now, I get put on 50 milligrams right off the bat, which is a high
That's a
dose.
whopper of a
It is.
dose. Yeah. The other question is, I'm not a pulmonologist.
Mm-hmm.
I'm not an allergist. There are other agents that they have in the US. Like one of them is called Singulair or
Yeah,
montelukast.
yeah, I've tried
And
those. Yeah,
okay, my gosh, you have exhausted a whole litany.
yeah.
So that again is going to be something important for you to share with your specialist on Tuesday.
Mm-hmm.
They'll probably want to know, when was the last time you tried this?
Mm-hmm.
How long were you on the medicine and what happened with the medicine? For example, if you were on an inhaler 10 years ago, and
Mm-hmm.
that was the last time you're on an inhaler, I mean, there's been changes in how the devices
Right.
fire the medication into the
Mm-hmm.
lung. So I don't know, just something to keep in mind that when you come armed to your
Yeah,
doctor's appointment with your list of questions, what you've
exactly.
tried, what hasn't worked, what has worked, etc. Yeah.
Yeah.
And don't forget, there's a reason that they're called vital signs, right?
Yes,
So
exactly.
your pulse oximetry, your pulse, your blood pressure, your respiratory rate, all important.
Well,
Okay.
I thought about that because I have an Apple Watch, like many of
Mm-hmm.
us do, and it can tell it does the O2 sat, but I also have the oximeter, the ET go home, come home,
Right,
oximeter
right,
thing.
right.
And I've been monitoring my oxygen saturations. And I think a lot of people since the pandemic know what O2 sats are because they talked about it, right?
Right.
People were encouraged to buy the oximeters. I remember when they first came out, we would have like a couple per unit, and all of a sudden we had to do all the patients' O2 saturations in addition to their temperature, pulse, and everything. It's like, oh gosh, it's this new thing, we have to do it. But it actually is good because I'm monitoring it. And yesterday, my oxygen levels dropped a little bit and I felt very lightheaded. But I also was having a lot of really bad coughing spasms too. So I'm not surprised. I would
And,
be,
I think the important thing also to keep in mind is also looking at trends.
yes,
I think one of the challenges is sometimes the layperson will see one abnormal value
yeah,
and they jump on that. And trying to understand that oftentimes we're looking at what is normal for you.
yeah,
What is your typical good day? What is your typical bad day? Whether we're talking about blood pressure, heart rate, temperature, respiratory rate, or
right.
oxygen saturation.
Yeah. And
So
that's what's good about this watch is because if you go into the health app on your phone, it tells you because it you can get it to tell your oxygen saturation and it does it continuously throughout the day at certain intervals. So you can
right,
see how you did. And so as I was going through the last few days, I was seeing 96, 97, 94, 89, 92, 96, 9, so there was a good pattern and we could really see. And what
right,
I might do is try and go back at the time of day and see what I was doing
right, right,
at the lower numbers.
right. Were you bringing in a whole bunch of groceries, or were you trying to run up a flight of stairs, or were you having a
Exactly.
coughing fit, or
Yeah.
whatever that case may be?
Yeah.
Yeah,
So what
yeah,
you were saying is really important. So when I go on Tuesday, I'll tell them my history. I'll tell them the drugs that I've tried that I can remember and since this started and
uh-huh,
how I feel.
right,
And then we'll see because what I'll tell him is, I mean, he's going to be able to see that I'm having difficulty breathing, but it's also affected my work. I haven't been able
right,
to do some recordings that I had to do. It's hard to give a presentation. A lot of my work involves speaking,
right,
but if you can't speak,
exactly. If you're huffing and puffing and coughing every few seconds, yeah. And it brings up the point that, at least the way that I was trained classically, in the 90s and aughts and beyond, is to immediately grab for a medication when I suspect that they're doing a lot more work with meditation and breathing exercises as well for asthmatics, just to help them with that. Because we do know that asthmatics typically have a prolonged expiratory phase.
Yeah.
So normally you should have an in breath for a count of 1 and an out breath for a count of 2. But when someone's having an acute asthma exacerbation, they can sound like they're whistling Dixie. So they're in for a count of 1 and they're out for a count of 5.
Yeah. Yeah. And you can feel it. And the cough hurts because the cough is like it's trying to force the air out.
Right.
It's a weird sensation. It's not like the normal cough that you get when you're exposed to something that makes you cough. It's just you feel the pressure as you're trying to push the air out.
Wow.
Mm.
There's nothing more important than your health.